Welcome, curious minds, to another deep dive. Today, we're tackling a topic that might sound incredibly specific at first glance, but trust me, it's a critical and often quite dramatic emergency in the equine world, full of surprising causes and really some ingenious veterinary interventions. We're diving deep into equine paraphimosis.
That's right. And this condition, though specific to horses, it offers a remarkable lens. A lens to understand the intricate, sometimes fragile physiology of these really powerful animals, and also the urgency required in their veterinary care. We've pulled together a stack of sources here to really unpack not just what it is, but why it happens, and importantly, what it takes for vets to resolve it.
Exactly. So our mission today is to give you a shortcut, basically. A shortcut to being well informed about this challenging condition. We're extracting the most important nuggets of knowledge and insight from our material. We'll explore its definition, the really wide array of underlying causes, some you might truly never guess, how it's diagnosed, and the often intense, sometimes quite surprising, treatments involved. Okay, let's unpack this. So first things first, to really get a handle on this emergency, what exactly is equine paraphimosis?
Okay, so at its core, it's the inability of a male horse, could be a stallion or a gelding, to pull its penis back into the sheath, the preputial cavity, once it's been extended. What's really critical here, the main thing, is that it's an immediate emergency, because that exposed penis is highly vulnerable to trauma, sure, but also drying, and most critically, progressive swelling. We call that edema, just fluid accumulation, and this can quickly lead to permanent tissue damage.
Right, the edema. And our sources highlight an important distinction here. It's actually the opposite of phimosis, isn't it?
Precisely. Yeah, that's a key point. Phimosis is when the horse can't get the penis out of the sheath in the first place. Paraphimosis is the opposite problem. It's already out, and it simply cannot go back in, which, as we'll definitely get into, immediately sets up a dangerous, vicious cycle of further damage.
Okay, this is where it gets really interesting for me, because the reasons why this happens are incredibly varied, and some are genuinely surprising. So what's the most common culprit that vets usually see?
Trauma. Hands down, that's the most frequent cause. We're talking about direct injuries. Things like kicks from other horses, bites, accidents during breeding, falls, or just blunt force trauma to the penis or the prepuce. This directly causes that initial swelling, the edema, or maybe bleeding, which is a hematoma, a collection of blood. And that swelling or hematoma mechanically prevents retraction. It just physically can't go back in. Less common, but still possible, is self-mutilation.
But it's not just physical injury, is it? I was reading that a specific type of drug can actually trigger this. That feels pretty counterintuitive.
It absolutely can, yes. A well-known, though maybe less common, complication comes from certain tranquilizers. Specifically, we're talking about phenothiazine tranquilizers. Expromazine is the classic example. So these drugs have what are called alpha-adrenergic blocking effects, which basically relax the specific muscles responsible for pulling the penis back into the sheath, the retractor penis muscles, and they also cause vasodilation widening of blood vessels. That combination leads to the penis prolapsing, just dropping out. Now, often it's transient, meaning it might resolve on its own, but it can become persistent if it's not managed quickly, especially if that edema, that fluid buildup, starts to set in.
Wow. So a drug meant to calm the horse can actually lead to this kind of emergency. That really highlights how delicate these systems can be. What else contributes to this unfortunate situation?
Well, general debilitation and overall muscle weakness are pretty significant factors too. Think about horses in poor body condition, maybe severely emaciated, or those suffering from chronic debilitating diseases. They might experience significant muscle atrophy, muscle wasting, and that includes those crucial retractor penis muscles. Also, prolonged recumbency. So a horse that's down for extended periods, maybe due to severe lameness and neurological disease, or even just recovering from anesthesia. Gravity alone can cause fluid to pool in the penis gravitational edema, making retraction impossible.
So the body just literally can't pull it back in due to weakness or just the force of gravity working against it. And neurological issues also play a crucial role, I imagine.
Absolutely, yes. Any condition that affects the nerves controlling the penis and those retractor muscles. Things like cauda equina syndrome, damage to the sacral nerves, rabies unfortunately, or even EHV1 myeloencephalopathy, which is a neurological form of herpes virus. All of these can lead to paralysis or just profound weakness preventing retraction.
And beyond the direct trauma or nerve problems, our sources also point to systemic issues. Problems causing general body swelling that can actually extend to this specific area.
That's right. Conditions causing generalized swelling, edema throughout the body, can unfortunately manifest here too. This includes having very low protein in the blood, that's hypoalbuminemia, which can result from things like severe liver disease or kidney disease where protein is lost in the urine, protein-losing nephropathy, or even severe protein loss through the gut, what we call protein-losing enteropathy. Also, severe systemic inflammatory response syndrome, or SIRS, that's a dangerous body-wide inflammation. Even shock or heart failure can cause such widespread edema that it affects the penis.
And less commonly, but still critically important, tumors.
Correct. Yeah, tumors of the penis itself or the prepuce. Squamous cell carcinoma is a big one, melanoma or sarcoids. These can cause swelling directly or create a physical mechanical obstruction that blocks retraction.
Okay, and finally, infectious or inflammatory conditions.
Yes, definitely. Balanoposthitis, that's inflammation of the glans, penis, and the prepuce. It's often due to infection, but could be irritation or even allergic reactions. This can cause severe edema leading to paraphimosis. And also priapism. That's a persistent, often painful erection that's not related to sexual stimulation. This can progress to paraphimosis because of the severe vascular congestion and the resulting edema. And here's what's truly fascinating and a really critical insight from our sources. It's how all these initial causes, whatever the trigger might be, feed into what vets call the vicious cycle. So regardless of the initial reason, trauma, drugs, weakness, whatever, once that penis is prolapsed and stuck out, gravity in the body's inflammatory response causes a rapid, often dramatic accumulation of fluid, that edema, within the penile and preputial tissues. Now this swelling then causes the internal preputial ring, think of it as the opening of the sheath, to become like a tight constricting band, almost like a tourniquet. This band then further impairs the drainage of venous blood and lymphatic fluid away from the area, which then, of course, worsens the edema and makes the swelling even worse. And the increased weight from all that fluid, plus the pressure, starts to stretch and damage those retractor penis muscles, and potentially the nerves as well. This makes spontaneous retraction absolutely impossible. It sets up this self-perpetuating cycle, and that cycle can lead to permanent penile paralysis and even tissue death, necrosis. It's a critical point because it means breaking that cycle fast is absolutely essential.
Wow. Okay. Given that complex list of causes and the absolute urgency you just described with that vicious cycle, when a vet first walks into the stable or the field and sees a horse with suspected paraphimosis, what's the immediate picture they're looking for? What screams emergency to their trained eye?
Well, the diagnosis primarily relies on those really clear clinical signs you can see right away, plus a thorough physical examination. And the immediate goal is twofold. Identify the likely underlying cause, if possible, and assess the extent of the damage already done.
Okay, so what are those key clinical signs you'd look for in that very first assessment?
The most obvious one, of course, is just seeing the penis visibly hanging out, protruding from the sheath, and the horse clearly unable to retract it. You'll almost always see marked swelling, that edema, and the exposed tissue, the mucosa, which is normally pink, might look discolored. It could be dark red, purplish, or even bluish if the blood flow is severely compromised. That exposed tissue can also dry out very quickly. It can crack, ulcerate, or even start to undergo pressure necrosis, tissue death just from the pressure and lack of blood supply. The horse itself might show signs of pain, general discomfort, maybe reluctance to move, or sometimes you see urine dribbling just because the swelling is physically impeding normal urination. In more chronic cases that have been going on for a while, the penis might have actually lost sensation due to nerve damage.
Right. So a visual inspection and careful palpation are absolutely key right off the bat. But once they've seen these signs and have a pretty good idea what's going on, how do vets then dig deeper? How do they pinpoint the exact cause and figure out the extent of the damage? What about specific diagnostic tests?
Yeah, beyond the physical exam and getting a detailed history from the owner or caretaker, vets have several tools. They might run a complete blood count, a CBC, and a serum biochemistry panel. These blood tests help assess hydration status, look for signs of systemic inflammation, check protein levels, especially looking for that low-protein hypoalbuminemia we mentioned earlier, and evaluate overall organ function. A rectal palpation can sometimes help rule out other abdominal issues that might be contributing. Ultrasonography of the penis and prepuce is actually very useful here. It lets the vet visualize the extent of the edema, detect any hidden hematomas or maybe abscesses, find subtle tears. And, importantly, it can help assess the vascular compromise, how badly the blood flow is affected. Using Doppler ultrasound, for instance. A thorough neurological examination is absolutely crucial if a neurological cause is suspected. And in some cases, if a tumor, neoplasia, or maybe an inflammatory lump, a granuloma, is suspected, a biopsy might be taken. And all this, of course, leads us right into the heart of the matter. What happens once the diagnosis is confirmed? How do you treat this?
Okay, so the horse is diagnosed. Our sources really stress that treatment is an immediate emergency. It focuses on reducing that swelling, protecting the tissues, trying to manually reduce the prolapse, and then preventing it from happening again. So what's the very first action plan? What happens right away?
The absolute immediate focus is reducing that swelling and protecting those exposed, vulnerable tissues. This starts with thorough but gentle cleaning of the penis and prepuce, usually with a mild antiseptic solution. Then, cold hydrotherapy is key. That means cold hosing or applying ice packs, typically for about 15–20 minutes every few hours. Gentle manual massage also helps. Massaging toward the body can help promote lymphatic and venous drainage, essentially helping to push that excess fluid out.
And here's one of those truly surprising details I found in our sources. What about topical agents? I read something about using sugar.
Yes, it sounds strange, but it works. Topical osmotic agents like granulated sugar or sometimes a hypertonic saline solution can be applied directly to the surface of the swollen penis. They work by creating an osmotic gradient. Basically, the high concentration of sugar or salt draws fluid out of the edematous tissues by osmosis. Often, petroleum jelly is applied over the sugar just to help hold it in place and create a barrier. After cleaning, maybe applying sugar, a thick layer of protective ointment is essential, something like zinc oxide or an antibiotic ointment. This prevents the tissues from drying out, cracking, and helps ward off secondary infections. Systemically, the horse will almost certainly get anti-inflammatories. NSAIDs like flunixin miglumin or phenylbutazone are common for pain and inflammation. Broad-spectrum systemic antibiotics are also usually given to prevent or treat secondary bacterial infections, which are a big risk. And in really severe cases of edema, a corticosteroid like dexamethasone might be considered, but vets have to carefully weigh the potential side effects like laminitis risk.
Okay, so after all that cleaning, cold therapy, maybe sugar, and medication, once that intense swelling is sufficiently reduced, how do they actually get the penis back into the sheath? That sounds like it must be incredibly difficult.
It definitely requires patience and often sedation. That's where manual reduction comes in. Once the swelling has been significantly reduced, and like I said, this can take anywhere from several hours to even a few days of this intensive therapy, then you can attempt it. It involves applying gentle but very consistent manual pressure to the penis. Sometimes an S-March bandage, which is basically a foam elastic rubber bandage, is wrapped around the penis, starting at the tip and working proximally towards the body. This helps to literally milk out the remaining edema, compress the tissues. Once the size is reduced enough, it's gently but firmly pushed back into the preputial cavity. And as you mentioned, this process almost always requires the horse to be well sedated, both for their comfort and cooperation and for the safety of everyone involved.
But just getting it back in isn't the end of the story, is it? It needs to stay there to allow healing. How is that managed?
That's absolutely crucial. Penis retention is the next vital step. After a successful manual reduction, the penis has to be physically kept inside the sheath for several days, sometimes even weeks. This is vital to prevent it from just prolapsing again while the swelling fully resolves and the muscle tone hopefully returns. The most common method is placing a purse string suture around the preputial opening, the orifice, usually using a strong, non-absorbable suture material like umbilical tape. It's tightened just enough to narrow the opening and hold the penis in, but critically, leaving enough space for the horse to urinate and for daily cleaning access. Other options include breathable support slings or commercially available penile repulsion devices. But regardless of the method used, that penis must be gently pulled out at least once daily, for inspection, for cleaning, reapplication of protective ointments, and to allow the horse to urinate freely. It's a very hands-on, intensive recovery process.
And while all these immediate steps are happening, the retention vets are also working on the underlying cause, right? But what happens if these medical approaches just aren't enough? Or for cases that have become chronic, maybe they weren't caught early enough.
Right. If medical management isn't getting the job done, or in those chronic, long-standing cases where there might be irreversible damage, then surgical intervention becomes the next consideration. This can range from relatively minor procedures like making relaxing incisions in a tight preputial ring to relieve that constriction we talked about,
Yeah.
all the way to much more drastic measures, such as a phylectomy, which is the medical term for penile amputation.
Penile amputation. Wow, that definitely sounds like an absolute last resort.
It truly is. It's considered a salvage procedure. It's performed for those chronic, irreversible cases of penile paralysis, or where there's severe tissue necrosis, or perhaps an untreatable tumor. The surgery involves removing the non-functional or severely damaged portion of the penis, and then creating a new, permanent opening for the urethra, usually in the perineal area, under the tail. That's called a urethrostomy. This procedure obviously renders the horse infertile, and it can sometimes lead to complications like urine scalding on hind limbs because the urination pattern is changed. Another surgical option that's sometimes mentioned is called reefing or posthectomy, essentially a form of circumcision. This involves surgically removing a portion of the internal preputial lining, the internal lamina. It's sometimes performed for specific types of chronic preputial swelling or scarring.
So after all these potential interventions, from sugar wraps to surgery, what's the overall outlook? What's the prognosis for a horse diagnosed with paraphimosis? Is it usually a good outcome, or is it more guarded?
The prognosis really varies widely. And the single biggest factor, as we've kind of hinted at throughout, is time. If treatment is started aggressively, ideally within the first few hours, maybe up to 24 hours of onset, the prognosis is generally excellent for return to function. However, the longer that penis remains prolapsed and untreated, the poorer the prognosis becomes. Because that swelling gets progressively worse, the vicious cycle takes hold, and irreversible nerve and muscle damage become much more likely.
So catching it early and acting fast is absolutely key, and I assume the initial cause matters significantly too.
Exactly. The underlying cause definitely influences the outcome. For example, cases induced by estepromazine generally have a good prognosis if they're treated promptly before major complications set in. Prognosis for trauma is much more variable. It really depends on the severity of the initial injury. Cases due to general debilitation or muscle atrophy can have a good prognosis if the underlying systemic condition can be resolved and the horse successfully regains weight and muscle strength. But neurological damage often carries a more guarded to poor prognosis, especially if the nerve damage is extensive or seems permanent. The extent of the damage seen on presentation is also critical. Horses presenting with really severe edema, active ulceration, tissue necrosis, or clear signs of nerve damage like loss of sensation. Well, they naturally have a more guarded prognosis. And crucially, something owners need to understand is that consistent and diligent nursing care, that daily management we talked about, and strong owner compliance with the treatment plan are absolutely paramount for success. Without that dedicated aftercare, complications like secondary infections, worsening nerve damage leading to permanent paralysis, or chronic scarring, fibrosis, can significantly worsen the outcome, even if the initial treatment was appropriate.
This whole deep dive into equine paraphimosis, it really underscores the incredible complexity of veterinary medicine, doesn't it? And the sheer importance of swift, informed action. From recognizing those critical early signs to understanding that huge range of potential causes, including, the surprising role of common medications, it's just a powerful testament to the dedication required in caring for these magnificent animals.
It really is.
Yeah.
And if we try to connect this to the bigger picture, what's truly highlighted here is how even what might seem like a localized, simple anatomical issue, well, it can quickly become a cascading problem with numerous systemic and neurological links. It's not isolated. It perfectly emphasizes how interconnected all bodily systems truly are, and why that critical thinking, digging for all potential underlying causes, is so essential in both diagnosis and treatment.
So, what does this all mean for you, our curious listener? Well, perhaps it's gaining a new appreciation for these behind-the-scenes emergencies that veterinarians deal with regularly. Or maybe it's just a powerful reminder that even seemingly minor issues can escalate with alarming speed in any biological system, human or animal. So next time you encounter a problem, maybe in a totally different context, consider this. What unseen vicious cycles might be at play? What critical, maybe time-sensitive interventions could prevent a small issue from snowballing into an irreversible emergency? Something to think about. Thank you so much for joining us on this deep dive. Until next time, keep exploring, keep questioning, and definitely stay curious.